Hi, I'm Mary Wong, and I'm a registered traditional Chinese medicine practitioner and acupuncturist, founder of Alive Holistic Health, author of Pathways to Pregnancy, and your life and fertility coach. Tonight, welcome to my 90th live post. Very excited. We're going to talk about detox and fertility. And with me, I'm even more excited because I have a partner in crime. You might have seen Tanya Smith in some of my previous posts, namely, actually the most famous one, if you haven't seen it already, we eat bugs for protein. A vegan option. Anyway, before we start, I want to introduce you formally as to who Tanya Smith is. She, like myself, has the same credentials in terms of as a registered traditional Chinese medicine practitioner and acupuncturist. A mouthful. And both of us actually graduated from the Canadian College of Acupuncture and Oriental Medicine. And Tanya has been in practice for over 14 years. And she's been with me at Alive Holistic Health Clinic for like 7 years. So it's so awesome to have her. So awesome for you to be here. Thank you.
I'm thrilled.
So let's not waste time. I think this is a topic that is very relevant because people ask us, every single day about detox, right? So, and I really want to hand off this conversation to you. And it's a topic that you love. So let's ask you some questions, shall we?
Yeah, please.
All right, cool. Well, I guess the very first thing is it necessary? Is detox necessary for fertility?
I think hands down, yes, absolutely. I think that, we're exposed to stuff all the time in the air we breathe and the food we eat, especially if we live in a city or we live near factories or anything like that, it's even more. And then our bodies just naturally, by the way they metabolize, produce things that need to be eliminated. So for sure, our bodies are set up to constantly be detoxing and eliminating and clearing out what's not needed, especially for our health. I think it's really important to detox, especially when it comes to fertility. There's hundreds of new chemicals in the environment and things that our bodies have never been exposed to. And they can wreak all sorts of havoc. Things like changing hormone balance and women's menstrual cycles, accelerated aging of eggs, changing the shape or the function or the number of sperm. Even during pregnancy, they can increase the risk of miscarriage or birth defects. So it's really important that these new things that we're being exposed to, our body has an opportunity to eliminate them. So yes, absolutely, detox is essential. And I think it's really, really important to talk about it. I think, though, where I see people making missteps a little bit of the time is that there's a difference between having a detox mindset and doing things where you're actually just detoxing daily. So the idea of a detox in the popular culture seems to be that you take a week or maybe even 2 weeks out of your regular life and you do some extreme situation. So you either eat a lot less than you're used to or eat, in a clean way to avoid putting more toxins in, which is a good idea, but it doesn't support your body's way of eliminating toxins. And then you just resume life as usual once that week or two is over. And I think the downfall of that is kind of like only cleaning your bathroom twice a year. It's, you actually have to do it more often than that in order for it to be a good situation.
Thankfully, I cleaned. I like that analogy.
I think it's important to kind of think about like, how can we on a daily basis do things that support our skin and eliminating things through sweat, support our livers and eliminating things out of our blood, support our kidneys and getting things out through our urination, support our lungs and our breathing and our ability to detox that way. we're supposed to be interactive with our environment. We're supposed to take things in, make use of the good things, and eliminate the things we don't need. And so I think it's really important. It's a really sign of good health when your body can do that effectively. And so using the idea and remembering that, oh, I'm exposed to much more than bodies ever have been, and maybe I need to do a little bit more to support my body in getting the things that I don't need out.
So to recap, you're saying then it's more like consistently over the long haul and things that you can incorporate every day.
Yeah. And it's not like magic or rocket science. This stuff is, the stuff that we keep being told over and over about eating a healthy diet. There's certain nutrients that really support our bodies so they're actually used in the process of detoxing. So the nutrients are actually bound to the toxin so that it can be eliminated. So that nutrient has to be in good supply. Otherwise, that toxin can't get out of the body.
That's right. And so then let's talk specifically, so what kind of things to help detox?
Things like B vitamins are used up in excess when we're under stress, particularly under a chemical stress. Let me just refer to my list. Flavonoids, really important. The liver needs these things in order to detox. So glutathione in things like avocado, watermelon, walnuts, fresh fruit is essential. It's kind of the building block of every part of detoxification. Leafy greens contain something called indole-3 carbinol, which is really important in getting excess estrogen out of the system.
Yes, take note. Guys, take notes. Then you know what? Can you go back? Give us, top 3 vitamin B. Oh my gosh, like foods that contain vitamin B.
Oh, foods that contain vitamin B. I don't have them offhand. The one that I always think of is nutritional yeast, but it's really not a easy one to incorporate in a day-to-day diet. B vitamins are in everything. Yeah. Like all the fruits and vegetables have B vitamins.
And the flavonoids.
Yeah, in most fruits and veggies. Also the branched chain amino acids. Protein's really important. So when I see people going on cleanses, where they're doing a week of juicing, and believe me, guys, I've done these things. I know, I know the sort of the way that it's talked about sounds really appealing. I'm like, oh, everything's gonna be clean. I'm gonna feel so good. But what happens is if you have a lack of protein in your diet, even just for a day or two, the liver will shut down its detox because from your body's point of view, there's some sort of emergency. There's like not enough food around. And so your body will stop those processes and switch over to survival mode. And so really you're actually shooting yourself in the foot in a way, because you actually decrease your metabolism, you decrease your detox pathways. And then it takes a while for your body to be reassured that everything's okay and to get everything kind of going up to speed again. So we approach these things in a good way, and we say, oh, I'm going to take care of myself. And really, actually, it's not an appropriate way from our body's point of view to go about things.
So then let's cover Chinese medicine point of view, right? Because really that's not even in our
expertise.
Vocabulary, and it is our expertise. So let's talk about that.
Yeah, I mean, Chinese medicine has no idea of detoxing. It doesn't. It doesn't.
It's not part of our medicine.
No, our bodies are all about like nurturing and supporting good health. And the neat idea with TCM is we're really brilliant at looking at the whole picture of someone's health and seeing where they need to be built up. So I had a client recently, and this is what got us talking about this idea of doing a talk on detoxification. So this client was put onto a juice cleanse, a very long-term juice cleanse. She was doing like I can't remember what she was having for breakfast, something very small. a juice for lunch, and like a vegan meal for dinner. And the approach was to help her body decrease estrogen to heal her fibroid. But from my point of view, this person was experiencing coldness. They were very tired. They had all these signs that there was not enough warmth in their system. And then they were put on this diet. And so our idea in Chinese medicine is that every food has kind of a temperature to it. And if you put warm foods into a cool system, it will warm it up. And if your system's too hot, you can put cooling foods in to help calm and cool it down. And so this person was already cold on the inside, and then was adding more cold to that. And so I could see her actually getting worse and worse. And, you know, the blood needs warmth and energy to move, and hers was stuck. And the adding more cold was almost like freezing it. And I could see that this approach was going to make her situation much worse. But
right. Yeah, absolutely.
You know.
So what I see then, when you say in this case, you know, it's like you're adding ice to ice. So you're actually contributing to the fibroid issue. Meanwhile, in your mind, you're thinking, oh, I'm going to clear it out, but you're worsening your situation, right?
Yeah. And so the way we would approach it with Chinese medicine is that first, you know, we have kind of like a basic, if we want to do some support, nutritional support for the body, and there's some problem, we always start with what we call a spleen chi diet, which is very simple, a lot of easy to digest food. And so particularly for warming the system and fertility, we would think of, you know, porridges and congees and soups and lots of gentle spices like cinnamon and cardamom and ginger to kind of add that warmth and that vitality to the system. And these foods, even though they're building, are also giving your body a rest. They're giving you an opportunity to not have more toxins to deal with, but also giving you the nutrition to deal with the toxins that you already have or that you're exposed to every day in your environment. They're giving the liver and the kidneys and the lungs and the skin the nutrients that they need to do their job.
Well, plus you're also helping to your metabolism, because it requires less energy to break down these foods that are highly digestible and warm, right?
That's right. Yeah. So when food goes into your stomach, it has to be made into soup before it can proceed to the small intestine, the large intestine, and be absorbed. And so the more work that your stomach has to do to make your food into soup, the more energy it takes. And so the closer that you can get to this soupy kind of diet, the better off you are. So there's, you know, difficult to digest foods that take a lot from us, that energy would then not be available for detox or for reproduction or for, any of the other things that.
I just noticed there are comments, so we need to actually address them.
Oh, let's.
So this is very cool. Thank you, Jessica, for adding this in. She has PCOS. And she has a question. I don't find it strange, by the way, just as a comment. You say that I didn't have my period for a few months. I started cannabis for back pain. I've been regular every month for the last 5 months. Could this be because of the cannabis? Interesting.
Well, I think potentially, I mean, it seems to be the thing that was included. I mean, I don't have the whole situation, but it seems to be the thing that changed how things were moving. And sometimes cannabis is a medicine, just like many other foods and many of the other herbs that we use. And there is a warming quality to it. And so perhaps there was something about the system that was blocked that this then allowed some movement to.
Yeah, and Ma Huang, which is the Chinese translation of cannabis, you're right, it can move and it can, so it increases energetic flow, right? So perhaps that can help with resolving. And we don't know, in your case, everyone with PCOS, there's different kinds of PCOS.
Completely.
So, and there's some kind of stagnation, that's for sure. And in Chinese medicine, we can look at it, like a damp and phlegm situation. There can be blood stagnation. There can be a deficiency. There can be stagnation of the liver energy. So maybe it's unblocking something there through that. But then, is there anything else that can contribute and help that scenario, outside of the cannabis itself? Not sure. Don't know your full picture. But possible, right?
Yeah.
Cool. Yeah. Thanks for that question. Now, the other thing you said that your store, my store has B12 shots. Are they good? I put them in unsweetened tea.
So B vitamins are generally pretty safe to supplement because they're water soluble, and so if you already have enough or too much of them in your system will just excrete them. So too much supplementation can be a burden on your kidneys, and ask them to get rid of things that you've put in excess. But B vitamins are one of the safe ones. They won't build up in your system.
For sure. Good answer. Good answer.
Thanks.
Okay. And the last one, do you recommend regular use of milk thistle?
So milk thistle is not in our materia medica.
That's right.
So I'm gonna defer the answer. I have had people who have used milk thistle as part of supporting their system after an IVF cycle, and when they want to give their liver extra support to help it with its big job of processing the extra hormones that are in their system. I haven't had anybody have a bad effect from it, but that's about all I know. I wouldn't take any herbal supplement on the regular without seeing a practitioner.
That's right. Not long term. And as Tanya says, it's more of a Western supplement. So, and that goes along with what are some of the other ones? Milk thistle, wheatgrass. A lot of people use these on a regular daily basis, right? And my advice is usually when it comes time for IVF, and if it is actually leaching things out into the body, that's not really appropriate when you're trying to create life.
No, yeah, and that was one of the things that we wanted to talk about, is like, when is it appropriate to do detox around fertility? And if you think about the environment that the egg is growing in, you really want to be careful about what the egg is exposed to. And so when you're doing detox, the purpose of it is to bring toxins out of the storage and into your blood so they can be removed from your body. And so that blood is also flowing to the area where the eggs are growing. And so you need to be cautious about what you're putting into that environment. So I think definitely sort of in the 3 months before you do a stim phase of the cycle, when that follicle, when you're doing IVF, or, in a cycle where you would like to try to conceive, in those 3 months, that follicle has been recruited and is starting to grow over a 3-month period. And so being conscientious about, not doing anything extreme. When we're talking about TCM kind of detox diet, where we're nourishing our system and we're giving the liver its support, it means that's completely appropriate. I certainly wouldn't suggest, a detox diet where you're taking herbs to purposely pull things out of your system, or even it's that black stuff. Anyways, I wouldn't purposely pull things into your system and into your circulation.
Not while you're trying to conceive.
While you're trying to conceive. Yeah.
So I will add this though, if that's okay.
Of course.
So it's a little different though when you're like done, let's say you've done a whole whack of IVFs and you actually have some embryos in storage, and you've had so much accumulated toxin or accumulated hormones, then it may be appropriate, as long as your energy store is also okay, right? So let's say, for example, I actually physically did this myself. So I did one of the 10-day detox things, but it was literally, I was in the phase of forget I'm done with creating embryos. I'm literally just trying to prepare my uterine lining. And in that realm, I had time. So I wasn't, trying to create good quality eggs any longer.
Exactly.
But like I had a whole whack of extra hormones that was not normal. So in that case, that kind of more of an intervention, I just felt a little necessary, and I didn't want to do it long term, right? So as you said, some people do it for a long time, and that can be very depleting. So I just wanted to quickly pull some of the extra hormones out and then start to nourish my body. And then I went and picked up my daughter. Who's now 6. There you go. You were going to say something else.
Yeah, no, I think that's an absolutely appropriate time, because then we're not concerned with the environment that the eggs are growing in. They've already done their thing. And so then you're working on preparing the environment. So, yeah.
After a transfer is safe to take with IVF? Oh, activated charcoal. Is it
Activated
safe
charcoal.
to take with IVF? That's not really Chinese medicine.
Not at all. I don't. I wouldn't.
I wouldn't myself.
I wouldn't. No. I mean, I can't see a scenario that they would be indicated in a. Are they saying more?
So yeah, because just to be clear, so meaning after embryo transfer, you don't want to do anything new. We don't want to do any kind of pulling out. We just want to nourish, right? Yeah. And support.
And calm and
Anything else? Yeah. Any more comments?
No, absolutely. Yeah. So in that window of time between when the embryos or the eggs have been retrieved and they've been frozen as embryos, and the time when you're doing the transfer, that can be, a couple of weeks, or it can be several months, or it can be a year. And so that's the time when, if you are going to do anything in a fertility cycle to help to sort of detox your body, and still, I would still be cautious about how extreme you go. But certainly, because you don't want to deplete your system, you don't want to set yourself back at all. You want to continue on this path of nurturing life and feeling vital and feeling good. I think, back to the daily detox idea, like eliminating things that are going to turn into toxins in our body, like sugar and refined foods. I think that's more of an important aspect to this, because those things throw all of our hormonal balance out of whack with the way that they affect insulin and cortisol. I think that's going to have a more significant effect on our ability to feel vital and feel good. So if I was going to suggest anything in terms of a detox, that would probably be sort of as extreme as I would go. But there are protocols out there that people use. And so if they are going to be used, the appropriate time to do them would be in that window before the transfer, certainly. And I would say even before you start to prepare your lining. But certainly once you're switching into that phase where you're going to support your lining, you're going to support life, detoxing is not it's not the right time for it.
No, and to add in another comment, I'm not sure, I don't believe we said it, but I apologize if this is what you heard. Ashley says that you had mentioned someone took milk thistle after an IVF transfer. So that's not what we would recommend.
No, not after a transfer. I've had someone take milk thistle after stimulation.
Yes.
Before their transfer.
That's right.
And they had no negative effect, but certainly not after transfer.
Yeah. So again, it might be the same kind of scenario as I had mentioned, where, it's between embryo pickup, right? And you had a whack of drugs and you just want to clean out a little bit before you go and pick up your baby. Your embryo, embryo transfer, right? So again, and to be very clear, we're talking about frozen embryo transfer versus fresh embryo transfer. Yeah. So, if you're doing a fresh embryo transfer, you only have either 3 or 5 or 6 days before embryo pickup. Not a great time to do.
No, because you're still working with the same lining, right? Yeah.
Yeah.
No, you
Okay,
have
great.
to.
I think that's it for the comments. Anything else you want to add about our conversation today? Oh, you're welcome, Ashley.
I think, I mean, it was really interesting to start to think about detox from a Chinese medicine point of view and how we see things, and really being able to see where a person needs to be supported. And sometimes it's not that they need to be more nourished, it's actually that they need to be more cooled, and there's too much heat and too much aggravation in the system. And so when we do our diagnosis, we can already see, oh, what would be, you know, a good approach for you, rather than sort of a one size fits all detox, because they're not appropriate for everybody. Some people would do really well on a juice cleanse. And so it's not that it's not good for anybody, but it's not good for everybody. And so I think it's helpful to have somebody let you know what would be the best thing for you and for your body and for your fertility journey.
Yes, and that's such a great and important point that you add in there last minute. And you know what? For anyone who's done IVF, you know, if you've done multiple rounds, they switch up the drugs, because even that, right? Even though they try to give you a protocol, which is quite general, they still have to tweak it to make it work for you. So, you know, when it comes to food and how you take that in, it's not going to be the same diet that will fit everyone as well.
Yeah. Yeah.
So thank you. Yeah, that's great insight and great topic. So thank you. It was Tanya's idea to talk about this. I'm like, yes, let's do it. So you'll come back and we're going to have her as one of our regular guests, because we'll all, you know, do our little combo chit chat.
Because we love what we do.
I know, it's awesome. And we love you guys. And this is how we give back. Listen, we both I worked alongside Tanya today all day long. And then we both raced home, ate dinner, and we're here with you. So this is what we're doing. No one pays us for this. No. So thank you. Okay, so just a little quick thing. If you haven't already seen, go down below. We have lots of talks, some of which are with Tanya already in the past, but I have like 90 posts now. So there's lots of great and fabulous, interesting topics, everything fertility related. So check that out. If you haven't done so already, please read my book, Pathways to Pregnancy, which Tanya just told me that, oh my gosh, some of her patients who I don't even know will comment and say, this is the best book ever. Yeah. So thank really you for telling me that. So what did you say? So it's like, I've read every book, and, you know, this is the only hopeful book they found. So, you know, it really touches my heart. So thank you for sharing that with me. And so I want to share that with you all out there watching. Please read my book, because I know that you'll find great value in it. And certainly I didn't stay up in the middle of the night for 1.5 years straight for nothing. Writing the book, my second baby. And the last announcement is that July, is it the 3rd? It's the first Sunday in July, and I'll be doing my 3rd live monthly fertility circle. So I'm very excited about that. I've been having fantastic feedback, in which, again, it's been very hopeful and transformative, because I give you not just straight up coaching, but really, you know, coaching you in your life so that you can thrive, not just to barely like hanging on in there. So we'll give you tools and strategies, and it's fun. It's 2 hours. I do 1 hour of talking, and then the second hour is Q&A, and I pop in some kind of exercise. So it'll be really cool. So join me. And then next week, our live post is for the Facebook live post is on Monday, and we're going to talk about laser, low-level cold laser. For those of you that are like, gosh, you know what? I really want to try acupuncture, but I'm freaking scared of needles. There is a solution. Laser is, there's lots of research now done on laser and fertility as well. So we're going to talk to Arn, who I forget the last name right now, and I can't even pronounce it. He's from Denmark. So we're doing it during the day on a Monday, because right now, if I do it at night, it's in the middle of the night for him. So I'm not going to do that to him. So that's it. Thank you so much for Tanya for being here as always. And we'll do it again. Okay.
All right.
All right. Have a good night, guys. Mwah. Love ya.